Nearly 80% of us will experience chronic pain at some point in our lives, but the use of opioids has arguably made the problem even worse. A new documentary explores a controversial solution. Here's a clip from This Might Hurt.
100 million Americans suffer from chronic pain.
This illness has taken a lot out of me, out of my family.
Just the worst pain that I've ever imagined in my life.
Millions of patients with pain have become opioid addicted.
We have this idea that when there's pain, there's something wrong with the body. It's not always that simple. The brain is powerful and can cause almost any symptom imaginable.
You're saying that if I fully express my anger, that's going to help me not have a headache?
Yes.
Okay.
People have been taught to suppress emotions in general. What I'm doing in my class is helping them express rather than holding it in.
I fought my whole life.
Just tore my life apart.
If you had told me a month ago that I could will my pain away, I'd have told you were on drugs.
Joining us to weigh in is a pioneer of this treatment for chronic pain, Dr. Howard Schubiner, and friend of the show, clinical psychologist, Dr. Judy Ho. Welcome to you both.
Thank you.
Thanks.
So, Dr. Schubiner, what is the basis of this treatment?
All pain is real. And it turns out that new science shows that all pain is actually created in the brain. It can be created in the brain when there's a physical injury, of course. But surprisingly, most people with chronic pain do not have a structural injury at the time that they're having pain. And this occurs for people with headaches, irritable bowel syndrome, and even most people with back pain. But we've got data to show this and document why this is the case. And this model helps people to actually cure the pain or eliminate it as opposed to simply coping with it, which is what most people are told they have to do.
Let me just kind of break this down for a second. I mean, the way we've learned about pain in medical school is the idea that you have nerve endings and that there's some kind of, provocation or injury sends it up to the brain. You feel the pain. You're saying that you've seen that people with chronic pain actually no longer have a physical impairment that would cause the pain?
Yeah, think about phantom limb syndrome, where they have pain in an area where the limb is missing, or you have pain in an area that's already been healed. And this is actually very common. When you touch a hot stove, it's not your finger that's causing pain. The nerve signals go to the brain, but the brain has to decide. And this is the amazing thing about new neuroscience called predictive coding, that the brain decides whether to turn pain on or not.
Exactly how does the treatment work?
For example, I saw a lady who had horrible hand pain, and she was typing every day, Monday through Friday. Her pain got worse and worse, and she thought it was structural. Her doctors thought it was all structural. And then I said, well, do you get the pain any other time? And she said, yeah, I get it on Sunday evening, and I haven't been typing at all. And that was the clue. That was the detective work. And as a doctor, you have to make an accurate diagnosis. That was the clue to say, no, this is her brain turning on pain. And this, as I said, is extremely common. So once we recognize that, then we can educate people about the role of the brain in pain.